Hello guys, good day. This is Anne of Reinforce Me Club. Today we are going to talk about diabetic food. Now, what is a diabetic foot? A diabetic foot, according to WHO, it is an ulceration of the foot, distally from the ankle and including the ankle, associated with neuropathy and different grades of ischemia and infection. Now, when you say ischemia, it means there is a decreased oxygen supply in a tissue. Now, what are the causes of diabetic foot? So the common cause is poor glycemic control, foot deformities, improper foot care, ill-fitting footwear, underlying peripheral neuropathy, abnormal foot pressure, poor circulation, and dry skin. Now, how does diabetic foot occur? Now, it happens when a patient with high blood glucose level in the blood in a long period of time, they actually makes the blood sticky. And when they flow and get along with these fat deposits in the blood vessels, they actually makes they accumulated in certain parts of the blood vessels, making them narrow and hard. And as a result of that, there is a lessening of blood flow, particularly in the lower extremities. That is why diabetic patients are prone to infection. In fact, some of them they develop the so-called cellulitis. Cellulitis is a condition that is caused by Staphylococcus and Streptococcus bacteria, which naturally lives in our skin, and they only take advantage when they have a chance to. And when a diabetic patient has blood glucose level in a long period of time, they became a prey of this bacteria and they develop cellulitis. Now, how can we prevent this diabetic foot? Now, it's important to check your feet every day. So you have to check for hard skin, cuts, corns, blisters, spots, and any red swollen area just on the foot. If there is a hard skin that bugs you and you might as well want to take it off, it's way better to consult it with a podiatrist first, and he will do the job for you. It's also important to wash your feet every day. Use warm water, mild soap, and a clean cloth. Wash your feet in a way that you wash your face this time. It's going to save you. And do not soak your feet, it will only make your feet dry, and never use hot water to wash your feet. Keep your skin soft using the so-called emulsifying ointment, and do not use moisturizer in between your toes. It will only make your toes like wet, and then bacteria will get into that. Do not walk bare feet. When it comes to your toenails, cut your toenails straight across. Do not cut down the sides of the toenails. Do not cut them short. And when you have blisters or minor cuts, you can wash them with lukewarm water. You can apply antiseptic cream and use a sterile dressing or a micropore to tape it. And if there is no improvement on the wound, have it checked with the doctor. So again, never use warm or hot water to wash the blisters. Lukewarm is enough. And in terms of blood flows in the lower extremities, it's way better to avoid sitting for a long period of time. Try to get up once in a while. You can try walking around, which helps you improve your circulation. When it comes to footwear, avoid pointed-toed shoes. Sleep on shoes, high heels, leather or plastic soles, or any patent leather which does not stretch. And you can also use a clean socks that fits well and not too tight, like cotton like. And in the most part, keep a regular check of your blood glucose level. And you can even ask a certified healthcare professional to check your feet at least once a year. Okay? All these things will save your life, save you money, and improves your commitment and accountability to yourself. And once again, I believe in you. This is Reinforce Me Club. I'm telling you, live, learn, and repeat until you make it. And again, have a lovely day. Thank you very much.